Okay, it's 2:47. We have about 106, 107, 108 people on, so we have a big group. My name is Anita Wisecup, and I am the Program Health Manager / Native American Health Liaison for the Office of Health Disparities and Health Equity for the state of Nebraska with the Division of Public Health. Just want to welcome all of you back and thank you for being with us today. I am pleased to introduce our second keynote speaker for the 2022 Nebraska Conference on Health Equity. We are honored to have a presentation from the Director of the Center of Public Affairs Research at UNO, Dr. Josie Schafer. Dr. Schafer's presentation is titled The Changing Demographics of Nebraska. This session will explore the latest sources that demonstrate how Nebraska's demographics are changing and the implications on health and society. We will be having a Q&A after this session, so please add any questions into the chat box. And with that, I'm going to let Dr. Schafer introduce herself. Go ahead, Dr. Schafer.
Thank you so much, Anita, and thank you all for being here. We're up to 125 participants. I think that's absolutely wonderful. I am thrilled to be with you today. As Anita was saying, I am Josie Schafer. I am the Director of the Center for Public Affairs Research. Our mission here at the organization, let me get my slides going. There we go. Is to collaboratively produce and disseminate high quality public scholarship on topics that impact the lives of Nebraskans. And we do that in a range of ways. I think you had a breakout today with the Census Bureau. We are a liaison to the Census Bureau for disseminating data from the Census Bureau here in Nebraska. You will see in this presentation a lot of data from the Census Bureau. I'll try to point out different sources from them, as well as some places that we make that data available on our website so that it's easy. And we also take a range of grants and contracts, working on, entrepreneurship, economic development topics, broadband access, lots of really important topics throughout the state. But probably the most important thing that we do is this right here. We try to make sure that everybody has great data on which to make decisions for better governance here in Nebraska. And I think this topic especially is unbelievably important. I want to point out some places where we are doing really well and some places where there are lots of opportunities for growth and betterment here in Nebraska. So looking forward to sharing all of that with you. As mentioned, I will take questions at the end, but please put them in the chat at any time. If you want to reference a slide, we can always come back to it and talk about it more. I really love being in person because then I can take questions at any time, but it does become a little bit more difficult here online. So let's get into it. So this is one of the most important slides that I will share, right? When we talk about demographics, we're talking about people, and this is the people of Nebraska. So since 2010, released with the 2020 census, the Nebraska population has increased 7.4%. That growth is better than we expected originally. Before the 2020 census count, we were thinking it was a little bit under that number. So we actually have strong growth statewide as compared to what is expected. However, 69 counties have lost population. The urban-rural divide in the state is getting larger, I would say, and because of sort of that population shift. So here you see in red, those are the areas that are growing. The orange is a little bit less growth, but still growth. Then this light color, that's sort of moderate decline, a little bit of growth. And then the gray to dark gray is population loss. So you will see that most of the state is in that gray to dark gray. We are seeing more population lost by county. Yet our overall population rate is up. You see our 2020 total population count. So let's look at how we are changing. So this is just looking 2020 to 2021, about 3 sources of growth or decline within the state. And again, I'm going to talk about statewide, and I'm going to compare to some other states to see how we are growing. So rate of natural change, that's births minus deaths, is still positive for Nebraska, and it's actually a big positive. So I sorted all the states on rate of natural change, and you will see we are towards the top. Anytime Nebraska stands out, I like to point it out. And so that is a real positive for Nebraska. We are still more births than deaths. And compared to many other states, right, many states you don't even see here, we are really strong on that one. We are also positive in terms of rate of international migration. I'll show that to you over time, but it's a small positive, 0.53%, meaning we are people leave for other countries every year, people come in from other countries every year, and more people stay, more people come than leave from international locations. But we are negative for our rate of domestic migration. So that's the people leaving for other states versus coming in from other states. We are negative. More people leave every year than come. So our major source of growth is still natural change. So Nebraskans having more Nebraskans, which is a really exciting element of our population. But it is also kind of jumping back. What you see here then is people are leaving from these rural counties, they are coming to the urban counties, and then they're having more children. So most of these urban counties are growing because Nebraskans are growing. So our rate of natural change is positive. And of course, some of this is positive too in certain counties. This is statewide. Let's dig in a little bit on the domestic and international net migration rates. This is we actually have this dashboard online at governing.unomaha.edu. If you're interested in checking it out, you can see domestic net migration and international net migration and domestic net migration for every state and even where people are going. It's kind of interesting. So I just want to sort of moderate what we've learned. So this gray line is actually our international migration rate. And you can see, like I showed here, it is positive. It's going between sort of 2,000 and 4,000, 6,000 people per year. It's not a huge number, but it is one of our sources of growth. Well, you can see our domestic net migration rate is been negative since 2010. A couple of places that people are coming from and going from. And that's data from the American Community Survey that we do make available on our website. What else do we know about our population? While our rate of natural change is still positive, we are an aging state. Every state is aging. Lots of states are having fewer kids every year. And so that baby boom, as that baby boom generation retires and ages, we are getting older. So this is population 75 and older by county. You will see many rural counties are a bit older, and I think that'll come into play. That sort of boom we're going to continue to see in aging. Another overview demographic trend I want to touch on is the percent of the population that identifies as a person of color. Here you can see population that is a person of color. I'm using race and Latinx ethnicity to define person of color. And you can see we range from about 5% to 93%. We are fairly white state overall. It is not huge numbers anywhere. Some Native American tribes definitely pushing those numbers up in some counties. But overall, we are still very white, growing in terms of population of color though. And I think that's a really interesting thing to point out. So this is from the 2010 to 2020 census. So I calculated the change in percent of persons of color. Now remember, 9%, 10%, 8%, right? Not huge numbers throughout most of the state. But then when we look at the change, then I sorted by how large that change is. What you will see is that most counties that are having the highest change in the percentage of their population that is a person of color are rural or non-metropolitan. Metropolitan areas are really just sort of the Omaha area, the Lincoln area, and then the Grand Island Kearney area are the only metropolitan communities in the state. So we do have Hall County in here, but largely very rural counties are changing in the proportion of their population that's a person of color. Thought that was really interesting to point out. One of the things we do, we work with state legislators and lots of elected officials to point out these data trends for them as well. So There'll be a couple times in here where I might point out sort of a misperception that I've experienced out in the world. And I think this next slide is one of those. So even jumping back, right? So there are counties where the percent of the population is a person of color. It tends to be either Native American, any place where that is particularly high, it tends to be Native American or Latinx. I hear a lot that the Latino population is largely foreign born. Now, I've talked a little bit about international migration, and I said it's not a huge number, but I also want to just point out there are lots of counties where we can look at the percent that is Latinx and the percent that is foreign born to kind of understand who's coming here. And I thought Scottsbluff County, which I just happened to be on this. So this is a data interactive on our website, cpar.unomaha.edu SDC. You can pull this information for every county. I'll have a couple other references to that as well. You can also go to our policy page and you can pull it for legislative districts. But if you see here, 23.8% of the population is Latinx in Scottsbluff County, but only 3.8 is foreign born. A lot of the people of color that are here in Nebraska are not foreign born. I hear that as true a lot of the times. It's not true everywhere all the time. For example, Dakota County, that has a much higher rate of foreign born. I was looking at a couple of these, but like I said, I was with someone from Scottsbluff and kind of discovered this. And I think it's important to point out that a lot of our people of color are first and second generation Nebraskans. They're not from somewhere else, right? That international migration rate of about 2,000 people per year is not totally what is transforming this. It's Nebraskans being more diverse as well. So I think it's important to point out. So those are some broad demographic trends that I point out to sort of everybody in every presentation. We're all interested in what that 2020 census data said in terms of population, our aging population, our strong birth rates now, but not necessarily going to keep up with an aging population, and our migration rates. So then I wanted to dig in on some of those social determinants of health. I know that's what this conference is about. I know you're talking about it in a lot of different ways, but wanted to show you some more of Nebraska's numbers. I'm definitely going to hit on healthcare access and quality, a little bit on neighborhood and built environment, not too much, lots on economic stability. I do a lot of data around the workforce and demographics of the workforce and occupations in our workforce. So that's an area I work on all the time. So I have lots there and a little bit on education access. I don't dig very deep in terms of quality in any of these areas, but just to give you a good overview of what's going on in Nebraska. So first one, we're going to talk about some healthcare access stats. You know, I think it's always important to point out there's not one good indicator of healthcare access and quality. So I'll show you a couple different indicators in each of these areas that help us kind of understand these things. This is the uninsured rate by county here in Nebraska. Overall, 8.2% of the Nebraska population is uninsured. You can see that varies by county, some going up, well up from there. Kind of see that pattern, kind of overlays with some others that we've seen as well. This is again an interactive on our website, cpar.unomaha.edu/STC. You can pull this data down yourself. We will be updating to 2020. This comes from the American Community Survey. We will update soon. This is the uninsured rate for those under 18 in Nebraska. I think it's really interesting. So it's lower, 5.3%, as you might expect. There tends to be programs for insurance for children. However, you will see that it's kind of got a bigger range than that overall rate. So there are still many counties that are quite high on that number, despite those programs being available. So definitely an indicator of some healthcare access concerns throughout the state. This is something I've been doing some healthcare policy and healthcare workforce data trends for some different groups. So I had this one, I thought it was worth sharing. This is the percent of the people that are employed as doctors or medical technicians by county. And you can see there's a lot of counties that are pretty low on this. This is the number and the percent of the workforce, so people 16 and older. So in terms of access, right? Well, I need health insurance to access, but I also need to be able to get there. And I think we have some real challenges in terms of availability of health professionals throughout the state. There are definitely, we talk about food deserts. I would say there's some healthcare deserts throughout the state. Regarding that and kind of getting into some of that infrastructure, we have a grant with the Nebraska Department of Transportation to support and promote rural transit. So I always want to point this out. There is public transportation available throughout the state. Here, anything red means they have some type of public transportation services available. You can learn more at nebraskatransit.com. If we kind of overlay that with that, lots of these places where someone might have to go to 3 counties to access services, there might be some help for them. A lot of these transit agencies are even managed by healthcare providers to make that access more available. Not a lot of people use or know about the service though. So really important to kind of think about. Okay, economic stability. Like I said, this is a pretty important topic to me. One of the things that we know about Nebraskans is they work incredibly hard. Any way we break it down, they work very hard. Now, obviously, and I'll show some of this during COVID, a lot of this sort of changed, morph, move around. But what I can say is the number of people in the workforce is back. Kind of our percentage is a little bit lower, suggesting a lot of people left the workforce after as a result of COVID-19 and chose not to come back in. But it's rare because most Nebraskans, if they can work, they're working. So here's what we know. How many people are working, pretty high labor force participation rate, lowest unemployment in the country. I think we all hear that all the time. Difference between labor force participation and unemployment, just so you know, labor force means I'm looking for a job or I have a job. It's full-time, it's part-time. It actually includes unemployed but looking, right? So that are people that want to be in the labor force and then are actually participating full and part-time. Unemployment rate is just those folks that want to work but aren't currently working. So it's just a different way to look at it. Labor force participation rate by race, ethnicity, and gender. I know I saw the keynote this morning, and right, nobody believes that, or I don't believe, that as a result of your skin color, you are more likely to work or less likely to work or more likely to make more money. But we do know as a result of structural barriers that may be true. I think I always want to point this out because I think it's so interesting. The labor force participation rate for Latinos is higher than the labor force participation rate for white. So here in Nebraska, everybody's working. Everyone's an extremely hard worker, male, female, really interesting. Some places we are #1 in the country, some of them positive, some of them not. Labor force participation rate of those age 55 plus is 48%, highest in the country. Jump down for a second. The labor force participation rate of those with a bachelor's degree or more is 90%. We hear a lot about brain drain. It is true, but there's lots of folks here with a bachelor's degrees that are working, highest in the country rate. But we also have the highest rate in the country for someone in the labor force and in poverty. Highest in the country of someone who's in the labor force and in poverty, 58%. We've looked at it to somebody working full-time in the household and in poverty, full-time year-round in the household and in poverty, highest rate in the country. So we also have some challenges for our workforce, right? Everybody working, but it's not always leading to social mobility, health equity, economic mobility, economic stability, right? We normally think, well, someone's poor because they don't work. That's not true. We have people in the labor force that are still in poverty. Let's dig in on why that might be. I think that's important to point out. Kind of difficult slide to look at, but just bear with me. So we have the number of people, so these are all occupations: business and finance, health diagnosing, education, instruction and library, transportation, protective services. These are occupations that folks work in. Population 16 and over is who we look at when we look at occupations. So we have the number of people employed. So in this case, lots of people in Nebraska work in office and administrative support. Kind of always funny to point out that very few people actually work in farming, fishing, or forestry. Here in Nebraska, that's mostly farming. When I tell this to a non-farm audience, they go, that can't be true. And when I tell it to a farm audience, they think 15,000 is actually a lot. I hear lots of stories about how one person can run 4 family farms that back in the day you needed 4 full families to run. So things changing there. Lots of our land and GDP comes from farming, but not a lot of people actually employed there. So that's how the number of employed is. And then on this axis, we have median wages here on our vertical axis. This is how much money on average at the median people make in these occupations. So computer and math, the median is 70K, highest here in Nebraska, compared to those folks working in food prep and serving, making about $11,000 a year. Okay, so what I've done is just put a red line at the average for both. So our median wages are about 40 to 41,000. This is for one person, not a household. It's about 50,000 for a household, 54,000. And then just to get sort of a sense of if a lot of people work in the occupation or not, I put kind of here at the average of 45,000. So essentially these are high wage workers, but we don't have a lot of them in the state. And right over here in this box, we have low wage workers where we have a lot of people working them. So for this first slide, all I've done is just add up below the line and above the line. And we find that more Nebraskans work below the line or in low wage jobs than high wage jobs. Kind of puts that poverty piece in sense, makes some sense of that piece, excuse me, right? We have lots of people working in jobs where they're not particularly large pay jobs. So they're working in low wage jobs, and that's going to, one, it attracts people who want low wage jobs, and we can talk about that. And so it actually makes us fairly competitive in terms of pay for low wage jobs as compared to high wage jobs, because we have a lot of those open or more available down here than up here, but it really keeps people in poverty, right? That economic stability is so important to moving up and out. And if they are in occupations that really just don't pay enough, they can never really do that. And we tend to have more people work, we have more people working down here than up here. However, these are the jobs that are growing the fastest. So now all I've done, it is the exact same picture, but I've made the size of the bubble is projections for what jobs are growing. So there are more high wage jobs than low wage jobs in terms of expected growth. That's out to 2030. I've also looked at it sort of year to year, and we tend to be adding more jobs up here. So we added about 10,000 jobs between 2019 and 2020 up here, while we lost about 9,000. So we're adding high wage jobs faster than we're adding low wage jobs. I will point out that healthcare support, so those home health aides, this isn't even nurses, this is kind of just folks helping out in hospitals and clinics. That we expect that to grow a lot, that occupation, and that goes right back to that aging population that is growing nationally and here in Nebraska. But high wage jobs are growing faster. So that's just going to put more pressure on those low wage workers, right? We've got to figure out what gets them from here to here in order to provide that social mobility. And because the economy is changing, right? As we add more high wage jobs, they're going to be more likely to lose their jobs. And I'll actually show that. So here, same picture, but now I've made this circle who went unemployed during COVID-19. So our unemployment rates went way up. I think we've heard that many times, different ways. And so all I've done is just sort of layer on who was more likely to be unemployed. And you'll see very high in terms of those low wage jobs about who was more likely to be let go, while many of these high wage jobs didn't have that. So one aspect of that was their ability to go remote, right? Think about myself. I'm on a computer right now. I do my job on a computer, could do it at home as well as I could do it at work. In fact, I probably spent more time. I probably worked more during COVID because it was just so easy to hop on my computer. Personal care, food prep, building grounds, cleaning and maintenance. They couldn't hop on a computer. You have to be very present. So particular to the COVID-19 pandemic, they were very likely to go be unemployed, but they were already low-wage workers. So it was kind of a inequitable effect, right? Low-wage workers, as a result of their occupations, were more likely to be unemployed. That created more economic instability, that created more inequities as a result. I remember actually being in with a bunch of senators talking about how they were going to spend some of the COVID-19 federal funding here in the state. And this was kind of hard because you want to help this group of people, but you also wanted to incentivize this group of people to move up here. And I think we're seeing that change now, right? A lot of people in these jobs chose not to go back. They were unemployed, they lost wages, maybe they went and got new training, new skills, or maybe they just felt it was, they didn't want to go back in person or back at the same rate that folks were expected. So as much as we are talking about a workforce crisis right now, a lot of it is in these jobs that a lot of people chose to leave and the pandemic and haven't come back to following the pandemic. On the flip side, we are doing everything we can to move people into these higher wage jobs and create opportunity here at the top. You'll see that, and that puts more pressure on that low wage workforce too. So one of the other, as I sort of talk about this high wage versus low wage difference, what makes these high wage jobs is the question I usually get. So I like to show this slide. There is a strong, strong correlation between educational attainment and income. The more education you get, the more likely your income to go up. Think about it. Computer and math need advanced education. Architecture and engineering need advanced education. Legal need advanced education. Business and financial need advanced education. Management needed, I think I made the point, right? So health diagnosing technicians and technologists definitely need advanced education. Okay, so there is a strong relationship between getting education and moving into a high wage job. Another way to see it is like this. So this is the percent of population at each level of educational attainment and their median income. So instead of looking by occupation, we're looking by educational attainment. The first thing I want to point out, we have 8% of the population which has less than a high school degree. Their median wages are $28,150. Now poverty, I can't put an easy line on it, some easy number like I can with a median income, right? Because it depends on family size. There are also estimates of poverty that take into place cost of living in a place. But my guess that working poor here in Nebraska, because like I said, everybody works, that working poor, probably in this group, right? Because what jobs can you get? I've actually kind of used this point before, but in 1973, a very small percentage of jobs required advanced degrees. Not true anymore. Now it continues to go up. It's well over 50%, and the projections just keep growing, right? More people are going to need advanced degrees every year to have these high wage jobs. Oops. So as educational attainment goes up, so does degrees. I thought this group was sort of not doing well. This group's not doing much better. These are our high school graduates making about $32,260 a year. Probably above poverty, but not great. And it's a really big chunk of folks. Here in the middle, we have our some college or associate's degree. Now I have separated this out before, I just don't have it here. Of this 33%, 10% are associate's degrees. So not most of them. However, here in Nebraska, it's a great job. Gets you to like 44,000. Not where bachelor's degrees are at 50,000, but it's a big jump. Definitely puts you over this line. Think about it, transportation, installation, maintenance, and repair. Amazing job here in Nebraska, paying over 45,000, so well above the median, and probably just needs that associate's degrees or some skilled training. So another group of people we could really help kind of move up in terms of those occupations, grow jobs at the top of the scale. Here, about 21% have bachelor's degrees. There is lots of research that demonstrates when you have a high concentration of people with bachelor's degrees, it's great for economic development. It really attracts new business. Also creates some slack in the market to grow new businesses and for entrepreneurship. And then 11% with a graduate or professional degree making the most. Totally makes sense, right? These are graduate or professional degrees. Many of these are graduate or professional degrees. These are graduate and professional. These are graduate and professional. High wage jobs are more likely to require, more education. And as a result, incomes tend to go up. So something we can do in terms of creating equity, making sure everyone has access to this. Now, I have done this by race and ethnicity. Again, I don't believe that your skin color dictates if you will go on to higher education, but we know there have been structural barriers for people of color to get higher education, and we know these are low. So the rate of folks with bachelor's degrees, graduate or professional degrees is lower. For people of color. I have another slide that's really interesting on this topic too. I've looked at race and gender interactions and median income, right? So the gender wage gap, the racial and ethnic wage gap. And I actually have it on a slide. I feel terrible I didn't bring it, but it's so Latinas are on the low end of the scale, making like 16% of white men, but we've actually even controlled for occupation and educational attainment, and we still saw really big gaps. I should send that to you all. I'm sorry I didn't have it. Right, so where is poverty around the state? That's what I want to show next. Overall poverty rate is 11%. We do absolutely have some variation in that. Some of the lower poverty areas tend to be over here, some higher poverty areas in rural parts of the state. I think, again, a lot of people think poverty is an urban problem. Here in Nebraska, it is more likely that rural counties are going to be high in poverty. And I've actually calculated that metro versus non-metro counties, and the average poverty rate is absolutely higher for our non-metro counties. This poverty rate for 65 plus, it's 8%, so a little lower than the overall rate. But again, you see really high rates of aging adults in poverty in our non-metro counties. Which kind of helps you think not just about racial equity as, again, this like racial equity and health equity as this kind of urban problem. I think that's where we hear it talked about a lot. But here in Nebraska, I think if we put all of these pieces together, right? Healthcare access, we know lower for rural. Economic stability, right? We are seeing poverty out in those rural areas, education access and quality. So another one I could have shared with you, but if you sort of layer on where the institutions of higher education are, where the concentration of people with a bachelor's degree are, they're in those urban areas. So then the rural area has sort of less folks with higher education. And what do we know about that? That means we have less folks working in those higher wage jobs, and then thus we have more economic instability. So pretty rural problem here in Nebraska if we think about these social determinants of health, right? If you put up an urban versus a rural person, the indicators suggest that rural folks in the state are going to really struggle in terms of health.